Hello everyone, I am Dr. Rajita, faculty of NEXTFELLOW. So today we are going to discuss mediastinum. So mediastinum is the gap between the lungs. You can see between the right and left gaps, which is these lungs are lined by the pleura. So the outermost lining is the parietal pleura, which is called as mediastinal pleura. So on each side, the mediastinal pleura is present, reflecting, and below the diaphragm is there. So this gap is called as mediastinum, which is the median septum of thorax between two lungs. If we see the mediastinum on the whole, it is bounded anteriorly by the sternum. So we can see the sternum anteriorly and posteriorly the vertebral column from T1 to T12, thoracic 12th vertebra. And on each side we know the mediastinal pleura is present, and inferiorly it is related to the diaphragm. This is the diaphragm, and superiorly it is related to the opening, that is the thoracic inlet which is guarded on each side by the first rib and anteriorly by the upper part of the sternum, which is called manubrium sterni, and posteriorly T1 vertebra. So that is totally forming a thoracic inlet. So those were the boundaries. And next, moving on to the subdivisions, grossly we can divide the mediastinum into superior and inferior mediastinum by drawing an imaginary line between the two parts of the sternum, upper two parts. This is the manubrium and this is the body of the sternum. So the manubrium is not straight with the body, instead it is inclined, making an angle of around 163 degrees. Internally this angle is 163 degrees, which is called as sternal angle, present at the level of second rib, second costal cartilage. So this is manubrium and body. So from the between the manubrium and body, start an imaginary line posteriorly, horizontally towards lower border of T4. This is the fourth vertebra, lower border of T4. So the pink shaded is the superior mediastinum and below is the inferior mediastinum. And inferior mediastinum, we can divide it further into anterior, middle and the posterior. Anterior is the blue one, middle is the where heart and pericardium is located, and posterior to the pericardium is the posterior mediastinum. So it is divided into anterior, middle and posterior. This is anterior mediastinum, middle where heart and pericardium, and posterior mediastinum. So these three are the subdivisions of inferior mediastinum. Superior mediastinum, let's see its boundaries and contents. Anteriorly, it is related to manubrium sterni. Posteriorly, from T1 to T4 vertebrae. And superiorly, that is opening into the root of the neck, which is called thoracic inlet. And inferiorly, an imaginary line drawn from the sternal angle till T4 vertebra. And on each side, of course, it is related to mediastinal pleura. Contents, we can divide the superior mediastinum into retro-sternal, intermediate and prevertebral structures. So retro means behind, just behind the manubrium sterni. We can see this infrahyoid muscles which are called sternothyroid and sternohyoid muscles. These two are there. And thymus gland, majorly it extends into superior mediastinum. Partly it is present in the inferior mediastinum also. Thymus, and also right and left brachiocephalic veins which joins to form superior vena cava. So both right and left brachiocephalic veins. These are retrosternal. And intermediate structures are arch of aorta. So we can remember arch of aorta, and nerves, phrenic nerve, vagus nerve, cardiac nerves, which are present on each side. This is the phrenic nerves, right and left phrenic, vagus and cardiac nerves which descend down. And just in front of the vertebra we have got esophagus. In front of the esophagus is the trachea. Trachea bifurcates at the level of sternal angle into two right and left bronchi. So these are right and left bronchi, which are the terminal parts of the trachea, which divides at the level of sternal angle. And we can see the arch of aorta also. Arch of aorta also begins at the level of sternal angle and terminates at the level of sternal angle, continuing down as descending aorta. So arch of aorta is also a content of superior mediastinum. And thoracic duct, which is the posterior most on each side of the vertebral column, it is present, and longus colli muscles are also there. So we can see here the green line is the thoracic duct, which goes and terminates into terminal part of subclavian vein. This is the subclavian vein. This is internal jugular vein, both joining to form brachiocephalic vein. So just before the formation of brachiocephalic vein, we can see the thoracic duct terminates here. Let's talk about the inferior mediastinum. We know it is divided into anterior, middle and the posterior. So contains anterior mediastinum. It contains the structures just behind the sternum and it is like between the sternum and the pericardium. So the structures are sternopericardial ligaments. You can see superior and inferior sternopericardial ligaments, and it mainly contains some loose areolar tissues, lymph nodes, and little lower part of thymus. I said thymus is majorly present in the superior mediastinum, partly in the anterior part, that is the anterior part of inferior mediastinum, and also some mediastinal branches of internal thoracic artery are the contents. Next, middle mediastinum. Middle mediastinum is the where heart is located along with the pericardium. So its boundaries are anteriorly sternopericardial ligaments, posteriorly esophagus and descending thoracic aorta. On each side, it is related to mediastinal pleura. Contents, it contains the pericardium along with the heart, enclosing the heart, and beginning of these great vessels which are enclosed by the pericardium, that is the ascending aorta and part of pulmonary trunk. So pulmonary trunk, we know it divides into right and left pulmonary arteries. Usually pulmonary trunk divides at the level of sternal angle. We can see here trachea is dividing at the level of sternal angle. Pulmonary trunk also divides at the level of sternal angle into right and left pulmonary arteries. And also 4 pulmonary veins, that is the termination of 4 pulmonary veins into left atrium posteriorly. They are also content of middle mediastinum. Then termination of superior vena cava, arch of azygous vein. We can see here, this is the arch of azygous vein, and superior vena cava, this is the superior vena cava terminating into the right atrium, opening into the right atrium of the heart. Then bifurcation of the trachea, we know that, and tracheobronchial lymph nodes, phrenic and pericardiophrenix vessels. These are pericardiophrenix vessels, phrenic nerve. So that was about the middle mediastinum. Next, about the posterior mediastinum. Posterior mediastinum, anteriorly it is related to bifurcation of trachea, which we just saw. It is a part of middle mediastinum, pulmonary vessels dividing into right and left, pulmonary trunk dividing into right and left pulmonary vessels, and it is related to fibrous pericardium, and it is related to the sloping surface of diaphragm. This is the sloping surface of diaphragm. So this is the posterior mediastinum, where we are seeing descending thoracic aorta, esophagus, and we can see the azygous, hemiazygous posteriorly, and transversely running structures like intercostal arteries and intercostal veins, which are draining, veins draining into the azygous and hemiazygous, and arteries are the branches of descending thoracic aorta. So all these are the contents of posterior mediastinum. So anteriorly it is related to trachea, bifurcation of trachea, pulmonary vessels and fibrous pericardium, sloping surface of diaphragm. Posteriorly it is related to the vertebral bodies, that is from T4 to T12 vertebral bodies posteriorly, along with the intervertebral disc as well. Then superiorly it is opens into the superior mediastinum, so separated by an imaginary plane. Inferiorly diaphragm is present. On each side, of course, mediastinal pleura, which is common for all types of mediastinum. Then contents, we can divide into longitudinal structures and transversely running structures. Longitudinal structures are esophagus, descending thoracic. Just now I have shown azygous vein, hemiazygous vein, thoracic duct, vagus nerves, splanchnic nerves, and some mediastinal lymph nodes. So let's see all these structures. So this is the descending thoracic aorta, and we can see the esophagus. This is from the other side. This is the esophagus, and this is the azygous vein which is arching along the root of the right lung. This is from the right view. This is from the left view. So this is the azygous vein on the right side, and this is descending thoracic aorta which is on towards the left side. And we can see here the trachea bifurcating. So this is the posterior mediastinum. Transverse, these are longitudinally again, azygous vein, thoracic duct, esophagus, and descending aorta. Thoracic duct. And also we have got splanchnic nerves. So those were the splanchnic nerves which are longitudinally present, and vagus nerves. And transversely running structures, we can see this transversely running intercostal veins draining into azygous venous system, and also termination of hemiazygous and accessory hemiazygous. So termination of superior and inferior hemiazygous vein, and deviation of thoracic duct transversely from right to left, and posterior intercostal vessels. You can see the intercostal vessels. So nicely they are present between the ribs. These are transversely running structures in the posterior mediastinum. So now just a schematic view for you to know. So this is the line about the sternum. This is manubrium sterni, which is the upper part of the sternum. So it is present at the level of lower border of T4. So this is an imaginary line which is from the sternal angle to the lower border of T4. So the sternal angle is 163. So please note down, it is approximately around 163. Sternal angle or angle of Lewis is very important landmark in the thorax. So heart is present in the middle mediastinum. In the inferior mediastinum, we can see the aorta arising, and the arch of aorta arching. So it begins at the sternal angle, it terminates at the level of sternal angle, continuing as descending thoracic aorta. And we know the bifurcation of trachea. This is trachea which is bifurcating, and bifurcation of pulmonary trunks. Pulmonary trunk divides into right and left pulmonary veins at the level of sternal angle. So these are few important things which you have to know. So let's do some questions related to mediastinum. So trachea lies in which mediastinum? I hope you all know the answer. Superior, anterior, middle and the posterior. So it is trachea and arch of aorta lies in superior mediastinum. And esophagus lies in the superior mediastinum and posterior mediastinum as well. So that was about the mediastinum. I hope you like this session. Bye, take care.